Okay, let's rewind. Calling the January 24th, 2022 meeting of the Council for Human Services to order. As a preliminary matter, this is Brooke Moore, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Sue Mittenden.
Yes.
Athlon Sweeney.
Yes.
Ruthie Tanico.
Yes.
And myself make a quorum. Staff, when I call your name, please respond in the affirmative. Jericho Mealy.
Here.
Ann Medina.
Yes, I'm here.
Great. And anticipated speakers on the agenda, please respond in the affirmative. Brenda Johnson.
Yes.
And Sunny Daly.
Yes.
Okay, good evening. This open meeting of the Council for Human Services is being conducted remotely pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Council for Human Services is convening by video conference via the Zoom app as posted on the town's website, identifying how you may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and take care not to screen share your computer. Anything you broadcast may be captured by the recording. All supporting materials that have been provided members of this body are available on the town website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. We are now turning to the first item on the agenda. Before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each of them to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in conversation with other members, please do so through the chair, taking care to identify yourself. For items of public comment, after the members have spoken, the chair will afford public comment to those members of the public that have joined the meeting via Zoom. Members of the public who wish to speak must state their names and be acknowledged by and speak through the chair. Finally, each vote taken in this meeting will be conducted by roll call vote. I need to get people to set a timer, see if I can break my record from one week to the next. Okay, having done that, let me get the agenda open. Okay, we've called to order, established a quorum. I would entertain a motion to approve the agenda as published.
So moved.
May I have a second?
Second.
Okay, from Athlon. All those in favor by roll call. Athlon?
Yes.
Ruthie?
Yes.
Sue?
Yes.
And myself. Okay, on to the good stuff. Our first, next item on the agenda is our Meet the Program segment. And today we're happy to welcome Sunny Daly from Health Imperatives. And Sunny, you know everybody? Have you met?
I've met everyone except for Ruthie, I believe.
Okay, so.
You probably met me at work at the hospital,
Oh, okay.
labor and delivery.
Oh, well then, yeah, I've met you. Sorry, I don't recognize you from your picture, or maybe it's because you're not wearing a mask in your picture.
Yeah, okay. So the rest of us are familiar and we'll just let you go ahead and start your introduction to Health Imperatives.
Great. So I'm going to share my screen with you all so that you can see some information about Health Imperatives as well, for those of us who are visual learners here. So thanks for inviting me. My name is Sunny Daly. For the last 5 years, I've been the site director at Health Imperatives on Nantucket. Health Imperatives is a nonprofit organization that runs several different programs on island. And as you can see here, we have been part of trauma-informed healthcare and human services for over 40 years. Those services are both offered on and off island, so along the South Shore, South Coast, Cape Cod, Nantucket, and on Martha's Vineyard as well. And really our mission is to improve the health and well-being of low-income or vulnerable families and individuals in Southeast Massachusetts. So on Nantucket, we offer 3 different programs. And I'm going to do this kind of backwards. The first program that I like to highlight is support for young parents. This is called the Healthy Families program. We also offer WIC nutrition assistance and the Sexual and Reproductive Health Clinic. And I like to start with the Support for Young Parents program because I think it's one that's often sort of the hidden gem in all of these programs. This is a program that is available to anyone who's parenting or pregnant for their first child and is 26 years of age or younger. And this is a free and confidential program, and it really helps families establish sort of a support system around themselves as they navigate parenting. So this, of course, includes some education resources, mentoring, and activities that really aim to connect families in the program to resources that are available in the community. We've done this in a lot of different manners, but one of the things that we really like doing as part of the Healthy Families program that is also utilized by other parents in the community is group education. So in the past, we've run positive parenting techniques class, which we received a lot of feedback on. Folks found this very informative because they often say, you know, you take a childbirth class, but then once you become a parent, you're kind of on your own. So this was really a class that was accessible to everybody parenting, but again, really trying to support first-time parents that were under 26 years of age to gain some skills on how to parent in a positive manner. So how do you set limits? How do you discipline? All of those things are good, but a lot of us don't really have a framework on what that looks like in a positive manner. We also ran a series that followed that. So the next class in the series was benefits of forming a routine with your child, healthy relationships. And this is something that was really geared towards helping families co-parent. And that can often be challenging on top of being a parent. So navigating the ins and outs on how to effectively co-parent. And then our last class was on contraception. And obviously, you know, this is tied to all of the programs. They all sort of are interwoven with each other, but contraception we feel is key in helping people plan their family size, which therefore influences other things like access to higher education, overall mental health strategies, parenting strategies. So this was a key in this series of classes as well. We do also have ongoing breastfeeding classes. We've done those in person. Right now they're on Zoom. This is available to anybody in the community. And then we also were doing the Happiest Baby class, which was to develop techniques for soothing children under the age of 1 primarily. All of these were free and available to community members. And we had a lot of participants, not only from the Healthy Families program, but from the community as well. In addition to the Healthy Families program, we offer the WIC program. This is a nutritional supplement program for income eligible families that have children that are 5 years old or younger, or they're pregnant, postpartum, or breastfeeding. This is, like I said, an income eligible program. So there are some strict guidelines around income, but I think the thing that can be encouraging to families is if they have mass health, they don't need to, in addition, income verify themselves. Mass health makes them automatically eligible. The same thing is true for anybody who's on SNAP or cash assistance. Again, they don't have to prove that. This automatically makes them eligible for WIC. WIC offers different food packages based on family size and based on if a family is expecting a child, or if they're breastfeeding, or if they have a child eating solid foods. And you may have seen the WIC stickers around the grocery store. They are specific foods. They're all considered whole foods, healthy foods. And the idea is the package offsets the cost of the food. So you go shopping at the grocery store, you put your items on the conveyor belt, and you scan your WIC card as part of your checkout, and it will automatically deduct the foods that are eligible for WIC. And then whatever is left is the balance that the family pays at the store. So this is a lot different than the way WIC used to be done. It used to be kind of a coupon book. Not surprisingly, we found that was a stigma for a lot of folks. So it's a much easier program now. Because of COVID, all of the services have gone remote. So families used to come in for things like iron checks and nutrition counseling. And now we sort of partner with their primary care doctor to make sure that they are attending those visits with their doctor. And then we're able to get that information. And then we provide not only the food, but then guidance on how do you cook food for children and for yourself, and what's a appropriate portion size, and how do I make foods that perhaps my culture traditionally eats, but with these foods that are part of the program and more nutritious. So the WIC program is not only that food component, but then also the nutrition program as well. And like I said, the breastfeeding component is central to that as well. So we do have lactation services as part of the WIC program. So yeah, I kind of talked about all of this here. And you can see here at the very bottom, which again, I kind of like to hammer home to you folks, because you may know people that say, oh, I'm not qualified for WIC based on my income. And then they forget, like, oh yeah, you have Mass Health. Well, you're automatically eligible, or you have SNAP, or you have cash assistance. All of that will make you qualify for WIC. So if there's ever a question, if you ever know anybody that thinks they may be eligible or is questioning it, just have them call us. We really work hard with families to try and help them qualify. We also understand that Nantucket is unique. We have a federal income guideline, but the thing that's unique about Nantucket, well, two, one is that we're very seasonable. So a lot of people's incomes go up very high in the summer and then drop off in the winter. So we try to work with families about timing their eligibility when their income is lowest, so that they can receive that supplemental nutritional food as they need it. And then the other part is just, we understand it costs more than perhaps what it does to live in Kansas. So we just really try to work with families to figure out, if WIC's not a fit, what else could be, or is there a way we can help you qualify for WIC? So just encourage folks to call if they ever have a question about, do they qualify? So that's the WIC program. And then the third program that we offer through Health Imperatives is the Sexual and Reproductive Health Services. Now, we've existed on Nantucket since 1978. I was 4 then. We used to be known as family planning. And that term family planning really kind of kept us in a box. So in the last 5 years, we've changed the name to be more inclusive to the services that we offer. So you can see here some of the highlights, and this is true across the board in all 3 programs. The staff speak English, Spanish, and Portuguese, and they're all based on Nantucket. And that's key, because often this is a first point of contact for folks that are referred to other programs as well. So we want to make sure that we can meet their needs in their native language. So we do have staff that are able to speak in all 3 languages. All of our healthcare is client-centered, it's trauma-informed, it's accurate, it's up to date, it's evidence-based, it's confidential. All of those things are like taglines for a lot of us in the industry, if you will. But really what it means is we work hard to meet people where they are. And I think that really in the last 5 years, it's become very evident that folks on Nantucket trust us for healthcare, where we have seen such an uptick in services, because we do have folks that not only speak their native language, but then also kind of understand the struggles of getting into healthcare and perhaps what that looks like physically, emotionally, and spiritually, if you will. The thing that's unique about our services is, yes, we do accept insurance, but if you don't have insurance, we're not going to turn you away. We do have a sliding fee scale available for uninsured folks or underinsured folks, and they tell us what they make for an income. We're not asking for pay stubs. And again, the idea behind this is to break down the barriers to healthcare, so folks can always access care, even if they're concerned about their ability to pay. The other part of this is we do often offer confidential services. So if somebody has fear of using their insurance because their partner may see that they've sought services and perhaps there's domestic violence or some other unsafe situation, we have the ability to not use insurance and bill confidentially. Again, using the sliding fee scale as a way of navigating around that. No one is turned away because of their inability to pay. So some of the services that we offer, some may be what you would expect, things like gynecological exams, pregnancy testing, options counseling, birth control, STI testing. But we go beyond that. And I think a lot of people may not know some of the other services that we offer, like cancer screenings. We do the reproductive cancer screenings, so breast cancer screenings, cervical cancer, prostate cancer. With that one, we have to refer, but again, a lot of the times this is a point of entry for people. So coming in the door, they can sort of talk their way through some of their concerns. And I will say a lot of our folks have not received healthcare in a number of years. So again, if we can get them in the door and connect the dots, then we're happy to do that. Some of the things that we are kind of growing in the last 5 years and moving forward are things like not only HIV and hepatitis testing, but then we're also using medication to prevent HIV and treat hepatitis C. So that's something that we've seen a lot of growth in, both the PEP and PrEP medication for HIV, and then hepatitis C treatment is coming online in the next couple of months. The PAP testing, which is part of our cancer screening, we are able to do follow-up testing. So LEAP and colposcopies, which for people in healthcare, you may understand what that means. For those of us outside of healthcare, this is sort of the next step. Once you have a pap smear, if something is abnormal, these are sort of the next steps to either remove tissue and biopsy it or remove cancerous or precancerous cells. So this is really huge, a huge piece in what comes next. And again, this is really in the last couple of years, we've been able to go from just being able to do the PAPs to now being able to do the colposcopies, and the LEAPs are coming in this next year. We're able to do HPV screenings, also the vaccine for HPV, that's human papillomavirus. It does cause cervical cancer as well as other cancers. Like I said, the HIV medication, all approved birth control methods are available. We do also offer gender affirming hormone therapy to anyone 18 years old or older. And as Jericho knows, we've been offering COVID vaccines. That will continue. Our goal with the COVID vaccines is to really reach the population that's not accessing vaccines, either through the hospital or through the town. So we're trying to fill that need more so than run a parallel COVID vaccine clinic, which is what we were doing before. Here's a little bit about the demographics of who we're serving. And this is based on last year's fiscal year. So we served 659 patients through the Sexual and Reproductive Health Clinic. Of those, 91% were female, 9 identified as male. 73% though were low to moderate income, and 60% of them were underinsured or uninsured. Like I said, this is often an access point for healthcare, so they may come in for one thing, but it's not uncommon to see some pretty significant and complex health needs. A majority of our population, 47%, speak a primary language other than English, and we do see a lot of newly arrived immigrants right now, mostly from Central and Latin America. So we've had quite a few successes in the last 5 years. I think, like I said before, we have seen a huge increase in access for folks that have had a lot of barriers to good health. One of the things that we did in order to do that was sort of take these 3 programs out of silos. So now when somebody comes in the door, it doesn't matter which program they're coming in for, we're sure to connect the dots. So if somebody's eligible for one program, we make sure that they know about the others. Because we understand that you might walk in the door for one thing, but it's not always the only thing that's going on. The staff at Health Imperatives in the last 5 years has transitioned from a service delivery model that was based off island and was flying people over to now everybody that works at Health Imperatives on Nantucket lives on Nantucket. And that means the doors are open 5 days a week. All the services, all the programs are located in one building. And then, like I said, we have a lot of buy-in now from the community. And what I love about it is when you run one of these group classes, you don't know if you're sitting next to somebody who's accessed services through Health Imperatives, or if they're a community member just coming in for the information that's given through these classes. And that's really how you break down a lot of these barriers and form a healthy community. We also couldn't do it without our community partners, of which we have many. Some of the challenges is, as we all know, the COVID pandemic has really put pressure on folks, especially those with fewer resources. As we also know, healthcare costs means that the cost of healthcare is constantly climbing. And then to do that on Nantucket, we all have our own struggles with how do we pay the bills in a place that, you know, we can't scale the cost of our healthcare for Nantucket costs. And we definitely are on the look for a new space in which to offer these services, because right now it's quite frankly a game of Tetris on how do we fit everybody in the building when we need to. It works for now, but with new space, we'd be able to really run all 3 programs robustly at the same time without literally sticking somebody, you know, on a rolling desk, which is what we often do. So that's a little snapshot of health imperatives. Thank you for letting me talk to you all about that. Does anybody have any questions about health imperatives? Brenda?
Through Brooke.
Through Brooke. Oh, Brooke, you're muted.
Thank you. I'm going to go to the board first and then I'll come to you, Brenda. Sue?
Okay.
Now I feel bad.
No,
you know,
that's just
cut
how
off
it
Brenda.
goes.
That's just
Remember
how it
that
is.
thing I read in the beginning?
Yes, membership has its privileges.
Yes.
So,
Sunny, if you want to stop screen sharing, then we can see each other more clearly. Excuse
Okay, let me see if I
for
can.
interrupting.
There we go.
There we go. Okay, now I can see everybody.
So Sunny, I'm thinking about somebody who may come in and, you know, gets their birth control through health imperatives, but maybe they do that separate from going to their primary care at the cottage hospital. And I'm wondering, like, will that information show up in their
No, it
file?
won't.
It's not connected at all.
It's not connected at all. So if folks want us to share information with their primary care doctor, just like you would do anywhere, you have to sign a release and we can share that information. But it's interesting. There are people that will come and see us because we're not connected to the hospital. So there is that sort of a break in communication, which has its benefits.
Okay. Yeah, yeah, when you think like your mom is a primary care physician or something and you whatever it is.
Yeah,
that's great
whatever
that
it may
there's-
be.
Yeah. Thank you.
Kathleen, any questions?
So my interest is around the gender affirming hormone therapy. So prior to 18, because a lot of people are finding out that they're interested in a different gender earlier than that. Can they come in to find out about, like, get some counseling around what they can do to prep prior to being 18, other information about resources? Is that something you guys offer?
Yeah, so we can offer in a general sense, you know, obviously we're not counselors, but we can talk very candidly about sort of what the trajectory forward may look like. But really what we do for people younger than 18 is we encourage them to reach out to Fenway Health, which is based out of Boston. And they are a huge resource, especially for folks younger than 18. They have not only the medical component, but also the counseling. They have parenting support groups. So they're kind of our first go-to if it's somebody younger than 18. And we have had some instances where folks have spent 2 or 3 years with Fenway and really have just need sort of maintenance, if you will. And they'll come to us with a full-on plan that's been signed off by a doctor, an endocrinologist, their therapist, their parents, everybody's on the same page, and we can kind of maintain from there. We have to have, obviously, parental consent, and we have to have our medical director sign off on anybody under 18, but there have been a select number of folks we've done that for.
Is Fenway offering telehealth for their therapy
Yeah.
and some of their services for here?
Yep.
Okay, great. Thank you.
Yeah, absolutely.
Thanks, Kathleen. Ruthie, did you have any questions for Sunny?
No, no questions.
Okay, thanks. Brenda, your turn.
Thanks. Sunny, when you do the breakdown of your clients served, I think it was 659. Do you break it down into groups? For instance, how many geriatrics? Anywhere 55 and older?
Yeah, we do. I do have that information, not off the top of my head, but yes, we have that information. Age
Okay.
group, demographics, all of that.
Yeah,
I
because
can
in my
do that
mind, I'm
for you.
looking for a place for you to be. In my mind, I am.
Yeah,
Thanks.
yeah, absolutely.
Great.
Brenda knows a lot about space.
I do. I'm
Oh,
the space queen.
As
Well
we're
then.
about to find out. Sunny, thank you so much for joining us.
yeah, thanks for having me.
You're welcome to stay or go as your schedule allows. The next item on our agenda is Brenda. And Brenda's been working on the planning for a new island, our island home, I believe,
Right.
is how it would be described. And
Mhm.
I'm very excited to get an update because I know there's been a lot of work going on. And so I'm going to hand the floor to you, Brenda.
Thanks. So is there anybody here that doesn't know me? Ruthie, you don't know me other than a particular area in our life. So I'm a nurse and I worked at the hospital for 45 years and I just stopped working there in 20, I think it was. And my last project was building the new hospital, the clinical project director for the new building. So the town has asked me if I would basically pick up the anchor, if you will, and move this island home along. And so that's what I'm doing. And what I've been doing is meeting with community stakeholders, meeting with groups like yours, meeting with staff, meeting with friends and family members, et cetera, and getting a sense of some of the challenges and issues. And we're also going to be starting to do a community outreach. And that's what I'm working on tonight is my presentation to my group tomorrow. But as you know, that the Island Home is a 45-bed skilled nursing facility. And the reason our plan is to keep it at 45. Now, the reason 45 is, first of all, that's what we're licensed for. We're duly certified in Medicare and Medicaid, and of course, then private pay. But 45 is the amount of beds that the government, the state of Massachusetts, will in fact let us have, because presently they have 7,000 beds in the state, and you just can't decide that you're going to increase your numbers based on whatever. So we'll need to get a determination of need to maintain those 45 beds and then support the reason why as we move forward. The town of Nantucket has done a tremendous amount of work over the last 7 years. I think I've looked back from 2013 to now, and there's been multiple studies. I would ask that if you're interested that you look at let me see, that you look at the article called The Future of Elder Care on Nantucket that was done by SK Advisors and Rabig Consulting. It's on the town website. And then the other one is Our Island Home's Future Demographic Perspective by Peter Morrison. The information in those, and then there's a Saltmarsh one. The information in those really does say it all. And, you know, I've known about it and I read it 5 years ago, but it's so relevant today that I think that it would answer most questions that you might have. So what we're asking the people of Nantucket town to do, after much conversation with the town council on elder affairs, Saltmarsh groups, other stakeholders, consultants, et cetera, is that as a result of the sessions and reports, it was concluded that the land the town owns at Sherburne Commons can accommodate the facility better than any other town-owned land. So the town is thereby asking for your community approval to go ahead and build a new island home on town-owned land on South Shore Road in front of Sherburne Commons. We'll also be asking for you to approve monies for the starting to plan the building. Presently, we've not planned the building. There have been all sorts of ideas that have gone along. You know, the small house version, you might have heard greenhouse version. We need to really look at that. And when I say we, it's the staff and the administration of the Island Home and myself, because when you think about it, presently we're licensed for level 2 and 3, and those those residents are pretty compromised as far as their ADLs and their medical conditions. They require a fair amount of help. When I look at these other versions, they're very nice assisted living, but I'm wondering, how are they going to do that? Do you see what I mean? So we really need to get the right people in the buildings to figure out how we can make it work for our needs. So what are our needs? Well, our needs are at level 2 and 3, but then we need to look at how can we make this version more sustainable? You know, right now the town is picking up the bulk of the deficit. But, you know, perhaps we could have a telemedicine room, and I'm just saying we need to do performers on this, but perhaps a telemedicine room where we could do a geri psych eval, or where we could do geriatric evaluation. Maybe we could have a memory care unit. Maybe we could have, oh my gosh, what else was I thinking? What we were thinking about, a hospice bed, because presently there isn't a hospice bed on the island. And that's a benefit that people have a right to access their Medicare hospice benefit. The hospital doesn't have one. The visiting nurses are certified in hospice, so perhaps we can collaborate with them. Perhaps we can collaborate with the hospital and other organizations so that we're not little islands unto ourselves. You know, there's a lot of educational needs in the community. I remember that during the China, we gave away a significant amount of money to Fairwinds for educating the staff so that they could educate other people. Well, there's pods of nurses' aides all over the island, and there's pods of nurses all over the island. And instead of using our resources, which are limited and time is limited, maybe we could share the resources so that we could educate the nurses all together in one area and the nurses' aides together. The trend towards home care, or towards aging in place, if you will, is aging in place and trying to age in the community. But the resources are not very robust, I guess you could say. The nurses' aides, it's hard to get nurses' aides, it's hard to get nurses. That hasn't changed. Housing is an issue. Of course, we're looking at the housing issue at the same time, but we're trying to collaborate with all these different groups that we really haven't before. And the other thing we're trying to do is spread the word about the island home. When you hear things going on in the community about healthcare, rarely do you hear anything about the island home. Now, tell me if you think I'm wrong, but do you ever hear anything about the island home? Today in Current, you hear about it because the COVID's up. Athlen once?
No, the
I
one
hear a
thing
lot about it.
Oh,
I hear a
go
lot
ahead,
about,
Ruthie.
sorry, I hear a lot
You-
about it.
You guys are supposed to go through Brooke. Sorry.
Yeah.
Sorry.
Yeah, so, yeah, Ruthie, that the protocol, I know you're new to town meeting, is just raise your hand electronically or otherwise, and then I'll call on you, okay? I'm gonna have Athlen go ahead, and then we'll take your comments, Ruthie. Go ahead,
Okay.
Athlen.
The one thing, and I hear about it very positively, is about the wheelers.
Mm-hmm.
Like
Yep.
when they go out on the bikes, and I've seen
Yep.
them out on the bikes. And so that's something that is I think through sort of word of mouth is out there, and that it's a really positive, good feeling activity that's done.
But we need to celebrate the people that work there, because you don't see them celebrated so much. And those are the things that we're going to be working on. And that's where we're going to need your help, the Council on Aging, the Council for Human Services, the Friends of Our Island Home. Once we get this promotional out there, we need your help to sort of help promote it, because the end goal is May 2nd is town meeting, and May 10th is the ballot. And so those are the two areas that we're going to be needing to talk to people about. We anticipate the elderly population is going to be about, in 2030, it's about 25% over 55. That's pretty high, you know.
Nick,
And go ahead.
Can I interject and let Ruthie?
Yes, absolutely.
Yeah, thanks. Ruthie, go ahead.
I was just saying that I hear a lot about our island home, a lot of things that are going, that are being held, like events. I mean, of course, with the pandemic, a lot of the things stopped, but it's, to me, very important about the elders and what they're doing, So I am pretty involved with our island home and what's going on with them.
And Ruthie, how are you hearing, who are you hearing this from? Is it a group of friends?
It's actually, I volunteered there at our
You
island
do?
home. Yes.
Okay.
I volunteer just to spend time, just to be a companion, spend time, play games.
Uh-huh.
I haven't gone this past few months only
Mhm.
because I have been extremely overwhelmed here at the hospital, Brenda.
Mhm.
And
Mhm.
we may have not crossed paths a lot, but I have met you several times at the hospital because I work nights and you work days. So I know you
Well,
very well.
Well, I haven't worked there in 2 years, so I'm okay.
Yes, I know, but I was here throughout the whole transition from old hospital to the
Oh,
new hospital. I was here before the new hospital was even built. And
all right. Then
we
I
had
know
to
I
wear
know
our,
you.
yes. So I just was informing you that our island home is very well known. A lot of people do know about our island home in the community, and I am one of them. Thank you.
Perfect. Perfect.
Thanks, Ruthie.
Thank you for that. That makes me feel good. So anyways, I'm saying this to you. One of the things that we're talking about is, I'm explaining what the island home is. I'm explaining what trends in long-term care. I'm going to be showing on this outpouring of information that we're going to be doing a roadshow, if you will. I'm going to show how aging is happening on Nantucket and also the benefits of building a new building versus keeping the old one. One of the challenges continues to be the site. People like the view. I get it, but I'll be putting on this, the challenges of having it be on that site. It's been deemed that that's not appropriate for multiple reasons, and that, they talk about expansion, et cetera. So we have a lot of work to do, and it'll be more formatted. I loved your little PowerPoint presentation, Sunny, and our goal is to do that with a map so that you can see where it's going to be. You always want to be very careful because people don't want to, if you put a little building on a piece of property, they think that that's what it's going to look like. No, we're just putting a piece of a little building on a piece of property so that people can get an idea of where it would be. It would be in the front of Sherburne Commons on the South Shore Road side. And that's where we're at. So if you have any questions.
Great, thanks. Athlon?
Thanks, Brooke. Brenda, thanks for talking to us tonight and telling us what's going on. I think it's important for us to stay up to date. One of the things I think about with Sherburne Commons, thinking about the fact that the move may take effect and go over to that area, is that as a parent, like I've been in and out of Sherburne Commons. As a social worker, I've been in and out of Sherburne Commons doing all kinds of community things. So like Diane Lehman has her piano recitals there. One of the things that I think would be very beneficial to think about is obviously thinking about the people who live at our island home and what they could tolerate as far as stimulus, but also thinking about what can go in there that can bring community members in, like Sherburne Commons does, because you get to see the people who are living there. You get to interact, you get to see what's going on. And I think that gives a lot of just organic knowledge of what's happening and just natural instinct to be like, oh, I see so-and-so there all the time now. They're there. And it's in your mind's eye, where they are now. And you have more propensity to visit. So
Yeah,
I think
we agree.
you guys, and I know resources are tight and difficult. So I know that that's a balance of how to figure that out. But I just think that that would be a wonderful thing to consider as you consider the new building.
Absolutely. Thank you. Thank you.
Sue?
Thank you. I jotted down while you were talking about trying to maybe collaborate with other organizations that kind of meet this, same population's needs. And I wanted to add the Veterans Administration.
Yep, they're included.
They're in there. Okay. I just want to make sure that was covered,
Yeah.
because as we age, there's always a lot of veterans. People still seek, use the VA for a lot of care on island. So
Yeah, they do. They do. And no, thanks for that, Sue. yeah, we're really targeting all the organizations that are, well, all the organizations. And it's just a matter of me getting to them. We'll have once we get this communication program done, we'll have a more formalized script, if you will. But right now I'm meeting with you just to sort of let you know that, hey, we're doing something. It's not dead in the water, and we're moving forward. And the ultimate plan too is to move Salt Marsh to where the island home is now. So that'll be in the works after the island home. But presently, number one is our island home, Sherburne, for all the reasons that it's been appropriate there, and monies to start the planning. And we're going to build a new building, and we anticipate that in 3 to 4 years. And it's pretty exciting. The benefits of the hospital being new was that, and Ruthie, you could sort of hopefully agree with this, is that when you have a beautiful new building to work in, it sort of makes other people want to start working there. It attracts other people. It's attracted doctors. The new equipment has attracted new doctors at the hospital. So hopefully, having a new environment, maybe having some added services would entice people to want to work there.
So thank you so much, Brenda. Some thoughts that I have is, when you think about continuum of care and levels of need, and that obviously in an island where the population is so small, and the level of need can vary from time to time, having a facility that can be managed more flexibly to accommodate the different levels of care needed by a particular population at any given time. And so I that's kind of how I'm thinking about things in terms of real estate's expensive. So the more variety of services that can be provided out of any particular square footage of space in buildings like this. And I love your ideas about bringing in other services. So when there's space on a space available basis, and sort of co-sharing certain spaces for a variety of different assessment activities, or that kind of thing. So that you can build an evaluation room, but if it only gets used for geriatric evaluations and there aren't any for weeks at a time, who else could be offered that space?
Right.
To hotel in, as I think is the phrase they use. But
yeah,
I'm excited that this is moving forward, and it's long overdue, in my opinion. So Sue, your hand's up again.
It is up again. You reminded me that another note that I didn't write down but meant to was my interest was really piqued when you talked about memory care. I've been talking to a number of people over the last year about memory care, and maybe having a memory cafe. And it's been a start and stop program idea for a couple of years. And so I would love to see something that could be housed within or adjacent to anything at Sherburne Commons. And if our island home is there, that would be great too.
So if you were to look at those reports that I had just talked about, and I'm going to put those on the information that we send out, memory care certainly was one of the elements that has been determined is needed on the island based on those reports. And I'm going to give props to Jericho's mother, because she's such a wonderful advocate for, making Nantucket a dementia-friendly community. And she's passionate about it, but she's good. I mean, she knows her stuff. And what's fun for me is being able to talk to these groups and getting to know who's got what strengths. So as we start to need people to pull them together for teams, you can pull the ones that have the interests, if you will. And Jericho, did you want to say anything through Brooke?
No, I'm good. Thank you.
Put him on the spot there, Brenda.
Always.
All right, great. Any other final thoughts from anybody present? Well, thank you, Brenda, for joining us tonight. Appreciate it.
Thank you, guys.
I am going to do my level best to share, this recording out through my social media, and you also will be able to find it on YouTube, the town's YouTube page, if you want to share it yourself, Brenda. So, and I'll let Sunny know that as well.
Yeah, and one more
So-
thing, Brooke, I have an email address for the town. So if you go to Our Island Home and look at the staff, you'll see my name, and my email address is oihoutreach@nantucket.mass.gov, I believe it is.
Yeah. Okay.
And people can email me anytime for anything.
Okie dokie. Thank you.
Thank you so much for your time. I appreciate it.
So much. Okay, next on our agenda, Jericho, update from our Human Services Director.
Okay.
Yeah.
Let's see. I'll start with behavioral health stuff. We've had a couple of meetings with the behavioral health leadership group that has been heading up the phase 2 part of the island-wide behavioral health reassessment. We've been taking on board a bunch of information regarding the state level plans. The state is putting a lot of money and manpower into behavioral health resources, including doing a statewide version of a variety of things we always wanted to do here, specifically I believe a universal crisis response, as well as a unified intake and billing system, working through MassGov. Basically, what this means is that we have to set up our behavioral health roadmap in such a way as we can take it as much advantage of state resources as we possibly can without being excluded from tailoring the system to local requirements. In the past, when there have been regional breakdowns of these sorts of things, I'm told that it was Cape and the islands tend to get unified, and that's 90% Cape and maybe 10% islands. So we're definitely going to try and have at least a certain core functionality hosted locally so that we have a degree of control on it. Right now, we're sort of bogging down in a couple of elements of it as we run into the complexities of doing the state planning as well. So I hope we are going to be pivoting to doing some addressing some of the other gaps identified in ways that are kind of a little more immediate, so that we don't lose momentum and that we sort of keep community participation and transparency going in all of these different sort of initiatives, because it will be about a year or so before we have any major movement on like the core roadmap stuff. So I would like us to be picking away at other gaps and other services that we can start adding on, so that this is actually a genuine, comprehensive behavioral health assessment and roadmap, and not just ways to find new treatment systems. I think it's really important that we focus at least as much on prevention and outreach to minimize the amount of trauma that people go through, because no matter how good the treatment options are, it's always better to not go through a mental health crisis than to go through one. So that's most of the behavioral health work. We're also in this round of CRC grants. There's at least 2 members of the CRC board here. That's the contact review committee. So we're going through, today it was the cannabis committee grants, and then we're going through a bunch of other human services groups. So a lot of the people who you will be seeing as the Meet Your Providers component of the CHS meetings, we're approving their money, hopefully, as we speak, or over the next couple of weeks. Moving on from human services, we are into, I guess, COVID related stuff. The most recent wastewater result came back in last Thursday, and it showed a pretty massive drop off in COVID in the wastewater, mirroring Boston and before that, a couple of European countries and Israel. Their wastewater patterns went roughly the similar way ours did, which meant a sharp spike of cases and then a rapid drop off of new cases. Basically, as the low-hanging fruit, or the people who are highly exposed, get infected and develop immunity to Omicron. So you can expect that hopefully to continue with case counts dropping this week and then hospitalizations and severe symptoms dropping even more in the following week, and expect that to follow here on the island. Past that is vaccination. We set up 2 clinics for the Nantucket New School and the Lighthouse School today. We're going to be doing those on Friday. We're going to be trying to set up, I've communicated with the Nantucket Public Schools to try and get a survey of outstanding needs for first and second doses for 5 to 11-year-olds. If anyone needs a 12 or if anyone needs any kind of dose for a more than 12-year-old, our Wednesday open clinic enrollment is the only way I am aware of right now to get a Pfizer dose on the island. There might be some internal clinics still, or some clinics running at the hospital, but I do not know what that schedule is like at this point. So if you know a 5 to 11-year-old who needs a vaccine, try and get in touch with me. I'm going to be trying to figure out a way to do pediatric vaccines effectively if I miss them at the public or private school, which I plan on doing a few more clinics each. For general COVID needs or COVID vaccine needs, we have the Wednesday enrollment. So Wednesday between 4 to 6, we have an in-person enrollment session for a vaccine clinic, which is generally on Thursdays. So you will sign up on Wednesday, and then not always, but for the most part on Thursdays, we'll be running a clinic. The enrollment session is in person because we had a lot of experience with online sign-up plans, and they get sucked up very quickly by people with free time, both to make the appointments and to get to the appointments. So this was an equitable way to try and distribute what vaccine appointments we have, and it allows us to prioritize first and second doses. At this point, any first dose is worth at least 5 booster doses in my mind, and that is sort of the operating procedure there. So in order to make sure that we can still get first and second doses in, and to not prioritize people who can refresh a web page very quickly a lot, we have got an in-person enrollment system that then will lead to, hopefully within 24 hours, an appointment. We do have limited we're setting the number of appointments we have per week ahead of time. Currently, we're doing 72 on this first full week. So we have 72 appointments available, and we will be prioritizing first and second doses there. So yeah, if anyone needs any kind of Pfizer dose, 4 to 6 at the trailer next to the old fire station on Wednesdays. And I think that's basically it for me right now. Yeah, go ahead.
And I will add, we have a new crew of native Spanish speakers who are volunteering at both the enrollment day and the vaccination day. And they've been an enormous help in helping people feel comfortable when they walk in the door as Spanish speakers. Yeah, so that's been great. So Athlon?
Thanks, Brooke. Jericho, I am curious if you've heard of any signs anywhere in the world of a variant after Omicron?
Yes, I know of 3 variants that could count as after Omicron. None of them have hit the threshold of variant of concern by WHO. So there are very much potential variants coming. I would be absolutely shocked if we don't have a domestic variant come out of this. Honestly, this number of cases hitting a mostly vaccinated or very well intervened, like there are a lot of treatments right now. If you have a vaccinated person who has a long infection or an asymptomatic infection that is infectious for a while, you're basically giving the virus a really good run to train itself to bypass immunity. We think this is actually where Delta might have come through. Is one of the case studies I read was that Delta was a single person who had one infection for 9 months or something like that. They had a compromised immune system, and instead of dying, the vaccine kept them alive, but it basically trained Delta to escape immune capture. Right now, having 300 million people get Omicron in a fairly short basis when it's a relatively well vaccinated population and we have continuing transmission means that I would expect at least one more variant before we hit a flu sort of seasonal equilibrium. So yeah, Omicron is we've probably made it through a good chunk of this. We will see spikes around travel because we use the wastewater numbers to kind of estimate an absolute maximum number of people who got Omicron over the course of the last sort of 3 weeks, assuming that, you know, the wastewater was accurate to within like a factor of 2. So we were saying 50, we were seeing 50 a day for most of it, but we doubled that, and doubled its prediction is to give us a worst case, and probably only about 4,000 to 5,000 people on Nantucket have gotten Omicron yet, which means that there is still a fairly large pool. So we will probably see spikes around travel. That said, I think that this was probably going to be the worst spike of the season, and that the travel related spikes around school vacations are going to be more minor, mostly because I think a lot of the students will have Omicron derived immunity at that point. So I would see smaller spikes. I don't think we'll have the hospitalization threat that we did early in the Omicron wave, but we're at least 2 more variants away from this being a really nasty flu, is my estimation. Well, is the estimation of the people that I'm reading who are trained in this.
Okay. Anybody else? Questions? Comments? Okay. Is that it, Jericho?
Yeah, I mean, that's basically it. If anyone has any questions, either on the behavioral health side of things or anything else, I'm also listening to that. And then, of course, if anyone has any questions on, or if any of these things occur to people to have questions over the course of a normal week, I am an email away. Same thing, if you know of anyone who's having trouble getting a COVID vaccine or anything, just email me and I'll see what I can do about getting them vaccinated. And then, also, so this is the one other thing that I did not talk about when I was talking about our open clinic, is that the enrollment sessions, I can do as many of those in as many different places as anyone wants. So if anyone knows of a population that is specifically underserved in terms of vaccinations, be it ideally first and seconds, but additionally, if there is an unboosted population of people, I can just go to them and sign them up there. So if you guys think of any place that might be a good option, let me know, and I can just sort of do an enrollment there.
Great. Thanks, Jericho.
No problem at all.
Okay. The elephant in our room is schedule and time of meetings. And so I know that Anne had circulated an email. It's a little awkward because we can't talk to each other. So it's this weird thing. My understanding is pretty much everybody who responded said that a 4th Tuesday of the month is a good option for a standing meeting. And so we're going to go with that schedule. We're going to skip the February meeting because that is school vacation week. And so we're just going to cancel February altogether and then move our discussion of the publishing of the court reports and other, other crime-related stuff in the media to the March meeting. And we'll be putting together, Athlon and Jericho and I will be putting together a list of people to invite to attend that discussion at our meeting, which would be the 4th Tuesday in March, and then the 4th Tuesdays thereafter. And finally, from my end, we will have 2 new appointees made by the select board for those seats that we were waiting, that got approved at town meeting, that finally made their way through the Attorney General's office and finally made their way through the committee appointment process. And so that is due to happen at the select board meeting this week. So by that March meeting, we will be a committee of 9. And I want to also remind everybody, if you are not going to be able to attend a meeting, to let Jericho or Ann know as soon as you know, so that we can anticipate whether we're going to have quorum issues and whether we should cancel a meeting. Thank you, Jericho, March 22nd. In advance, so that we don't have a non-quorum group of us appear and then not have a quorum. So to the best of your ability, heads up if you're unable to attend regular meetings. And now that we're going to have a better meeting cycle and schedule that's more predictable, hopefully, without all those holiday issues. So any other comments or new business from board members before we adjourn? So
I want to happily announce that starting next Tuesday, Gosnold will be having a clinician on site. The SOAP program is officially launching. Their clinician, his name is Glenn. I actually had a Zoom meeting with him last week. Seems like a nice guy. So I'm looking forward to them being on island and in the office 3 days a week, plus Suzanne and I from NAMI will be also in the office there. We're cohabitating and assisting with referrals and whatnot in that space and answering their phones. So that's a boon for the island community to have more options. And my understanding is the SOAP program will be open to people both insured and uninsured. So that's great news.
could you spell out the acronym for us for the public?
Absolutely. Structured Outpatient Addiction Program.
Okay, great. And location is?
35 Old South Road. Currently the sign outside, it's next to Swain's Travel and it says Gosnold. It will have Gosnold and NAMI on it in the near future.
Great. Thank you very much for that. Anything else? Athlon?
I was wondering, Sue, if you describe what the SOAP program is. Is it like an IOP, like a more intensive outpatient?
It is a step up and a step down program. So it's it involves coming, I think, 3 days a week, or depending on, I guess, a person's individual plan, but it's both individual and group work with the therapist.
So is it sort of like a full day program? Like if you're going to come 3 days, is it hours of time you're spending doing group and individual? And
Yes. Yeah. It's
Okay.
like, I think that it's like maybe a half day for
And do you
the,
know how many people they can accommodate?
I think they're aiming for 5
Okay,
to start. Yeah,
great. Good to know. Thank you.
you're welcome. So if you have any referrals, please let us know. We're excited to get this started for the community. And also with a different hat on, I wanted to say the warming place is going strong. We've got a group that comes pretty regularly and lots of volunteers from the community. We're super grateful and it's quite a heartwarming and body warming experience to help people out. So
That's great. Good to hear. Good to hear. Okay. Let's see. Oh, yeah. Okay. Okay. If there are no other board comments, I would entertain a motion to adjourn.
I will make that motion.
And a second.
I'll second.
Okay. By roll call. Sue,
Yes.
Athlon,
Yes.
Ruthie,
Yes.
and I vote yes. So thanks, everybody. We'll see you on March 22nd for our next meeting.
Bye. See you
Excellent.
guys then.
Night,
Okay,
everybody.
and find this. I'll try get staff to send out the link when the video is available. So if you guys want to share it and build a little more community awareness of what we do.
Great.
Awesome. Thank you.
Thanks a lot, Brooke.
Okay. All right. Take care, guys.
Bye, everybody.
Thank you, guys.
Bye.
Have a good night, everyone.
Good
Bye,
night.
Jericho.
Thank you, Ann. Thanks, Jericho. Bye.